And in this video, as the trial of the nurse Lucy Letby nears its conclusion, the jury now hear from the judge and his final summing up of the case against Lucy Letby. The judge refers to the case of Child J, born at the Countess of Chester Hospital on October 31st, 2015. After a short time, Child J produced some brown bile and was transferred to Alderhay Children's Hospital for surgery. She had a perforated bowel and was fitted with a stoma. She returned to the Countess of Chester Hospital on November 10th and progressed well, moving into nursery room 4. She had issues with gaining weight, but hospital staff were not overly concerned. Nursery nurse Nicola Dennison said babies with stomas don't tend to grow very well. Child J's mother had stayed with Child J, giving cares prior to leaving on the night of November 26th, 27th. Letby was messaging a colleague prior to this shift about how nursery nurses should not be caring for babies with stomas, and there were issues with staffing, saying they would have to send some babies out to other hospitals. During the shift, Child J had 2 sets of sudden and unexpected desaturations, which required resuscitation. In the latter, there were symptoms of a seizure, something Child J had not had before or since. Dr. Bowen said there was no cause for the events. Dr. Evans said the infection could not be ruled out. The prosecution said Letby did something to cause deliberate harm. The defence say in the absence of any identifiable cause, the jury cannot be sure Letby did anything to harm Child J. Mary Griffith recalled an event between 5 and 6 a.m. when she heard an alarm go off in Nursery 4. She saw Nurse Dennison had neopuff on Child J as she had desaturated. Dr. Verhees recalled attending once at 5:15 a.m. Swipe data showed him entering the unit at 5:03. He said he was told what had happened to Child J, that Child J had 2 profound desaturations, the first to 30s, the second to 50s. In the latter, Child J was pale and mottled. He said at least one of those events was significant. Apart from Child J's increased efforts to breathe, Child J had recovered well. Child J was moved to room 2 where Letby was. Letby said it was widely talked about that nursery nurses were doing stomas when they shouldn't. She said it was a very busy time. Dr. Gibbs was on the unit when Child J desaturated again, this time with a falling heart rate. He said he assisted nurses Griffith and Letby. Dr. Gibbs noted Child J had desaturations to unrecordable levels, the first at 6:56 a.m, the second at 7:24 plus bradycardia. They were associated with stiff arms, clenching of hands, and on the second occasion the eyes deviated to the left. These were symptoms of seizures. The first took 10 minutes to settle and the perfusion was poor. The second took 5 minutes to settle, both requiring ventilation. Dr. Gibbs could not explain the desaturations, and Child J had not presented with these symptoms before. He would say they were caused by a drop in oxygen, but the cause of that was not known. Professor Arthurs reviewed the images for Child J. After the last collapse, the image was unremarkable. It could not assist in an explanation for this event. In police interview, Letby recalled Child J as she had a Broviac line and stoma. She thought she only treated Child J after the collapse. She said she had administered medication as Nicola Dennison was a nursery nurse and not qualified to administer such medications. She accepted searching for Child J's parents but could not recall doing so. In evidence, she said she was aware of the second pair of events, that she and Mary Griffith heard the alarm and saw Child J fitting when they arrived. No one else was present and Child J recovered. Dr. Stephen Breary noted no blood glucose abnormalities to explain the seizures, and there was nothing of concern in the blood results. Abdominal x-rays did not raise concerns and said it was a remarkable recovery for her. He did not understand why Child J had been hypoxic. Letby was the designated nurse for Child J the following night and there were no concerns raised. Dr. Evans said the collapses were unexpected. The second pair were more serious and indicative of something wrong with the brain. He could not explain any natural process that had caused that hypoxia. Dr. Bowen said infection was not responsible for child J's collapses and did not come to any major conclusion other than the deteriorations were sudden and unexpected. The trial judge begins referring to the case of child K, born at 2:12 a.m. on February 17, 2016, weighing 1 pound and 8 ounces. She was transferred to the neonatal unit prior to transfer to Arrow Park Hospital, where her condition continued to deteriorate, and the mother agreed in the most heartbreaking decision of her life to end life support for child K on February 20th. The prosecution say Letby attempted to kill child K within 2 hours of her being born, interfering with the breathing tube, causing her to collapse. There were 2 further collapses, and the prosecution alleged there was sabotage by Letby, but they are not the subject of charges. There is no expert opinion on child K's case, and the evidence is circumstantial, the judge says. The prosecution urged the jury to rely on inferences. The defence point to child K's extreme prematurity and no direct evidence of harm caused. Child K was given surfactant late, and the witness Dr. Ravi Jairam's evidence is tainted and unreliable. Letby had no recollection of events, but believed the ET tubes were not secured correctly. The oxygen saturation of 85% was good for child K minutes after birth for a baby of her gestational age, and good enough to attempt intubation. Dr. James Smith said if he had seen any evidence of trauma or bleeding, he would have asked a consultant to step in and carry out the procedure. Nurse Joanne Williams said a team would carry out the procedure and the ET tube would be secured so the tube does not slip. Child K was transferred to the neonatal unit on a resuscitator with the plan to transfer to a tertiary unit. Mr. Myers referred to a leak on the ventilator in his closing speech. An Alder Hey consultant said that air leak numbers did not tally with the high oxygen saturation readings for child K. Joanne Williams said if child K was not receiving the oxygen saturation required, the alarms would have gone off. Surfactant was administered, which Dr. Smith agreed was late by 13 or 18 minutes, but would not have compromised child K. Joanne Williams was child K's designated nurse and left the neonatal unit at 3:47 a.m, an hour and a half after child K was born, to update the parents. She said she would not have left child K alone if she was not stable, and would have had someone to look after her in her absence. Dr. Jairam and Nurse Williams were happy child K was quite stable. Joanne Williams said in cross-examination the morphine infusion for child K, timed at 3:30 a.m, could have been at 3:50 a.m. Dr. Jairam said he was aware Letby was alone with child K and thought he was being irrational, but went to check on child K as a precaution. Dr. Ravi Jairam said he walked into the nursery room and saw Letby by child K's incubator and saw child K's saturation levels dropping to the 80s. The monitor alarm was not going off. He said, "What's happening?" Letby said something along the lines of, "She's desaturating." Dr. Jairam ascertained the ET tube was not working as it should and child K was ventilated. He said babies usually desaturate after about 30 to 60 seconds, so the cause of the desaturation would have started before he went into the room. Dr. James Smith saw Dr. Jairam on the right-hand side of the incubator as he walked in. He reintubated child K. The court had heard it was possible for a user to pause the monitor alarm for 1 minute. Dr. Jairam was challenged about why he had not confronted Letby about her behaviour. He said it was not appropriate to raise concerns in medical notes. He said concerns were raised after this incident and faith was put in senior management, to which Dr. Jairam was told that it was unlikely anything was going on and to wait and see what happens. He said in hindsight he wished they had bypassed management. Dr. Jairam said he could not remember the transport team note where he had written "baby dislodged tube." He said it was highly unlikely child K had dislodged the ET tube. He accepted the note child K had been sedated after the desaturation, but denied altering his account to fit the evidence. He said he had not seen the swipe data for timings. Letby in interview said she could only remember child K because of her size. She did not recall child K's tube slipping or any collapse. She agreed she thought Joanne Williams would not have left child K alone if child K was not stable. She could not remember if the alarm was silent, but agreed it should have sounded if child K was desaturating. She thought it possible she was seeing if child K was self-correcting. In evidence, she said she did not have any independent memory of child K other than her being a tiny baby. She said although she had no memory of it, she said she would have waited 10 to 20 seconds to see if child K self-corrected, as that was common practice. Elizabeth Morgan said in agreed evidence it was possible for an ET tube to be dislodged in an unsedated and active baby, and a nurse would not leave a child alone in this situation if the baby was not settled. She said it would be good practice to observe the baby immediately and take corrective action if necessary if a baby of this gestational age had begun to desaturate. She believed it would not be normal practice to wait and see in a child of this gestational age with the lungs so underdeveloped. At 6:15am and 7:30am, child K desaturated again, and it was noted the ET tube had dislodged again in the second event. Letby was on duty. The transport team arrived for child K, who required several rounds of treatment to stabilise her. She left having been stabilised at 12:50pm. The prosecution say child K was a settled baby who would not dislodge a tube. There was no record of an ET tube dislodgement at Arrow Park. Child K died on February 20th, 2016. The cause of death was extreme prematurity with severe respiratory distress syndrome. Letby, in further interview, said she had no memory of child K's ET tube slipping and suggested it had not been secured initially. She accepted searching for child K's mother's name but could not recall why. In evidence, she said she had nothing to do with the events at 6:15 and 7:25am. She agreed she had no reason to be in room 1 at 7:25am. She said she looked up the mother as, quote, "You still think of the patients you care for." She said the night shift was a busy one. The judge says the prosecution accept they cannot prove Letby's actions caused child K's death, but say she attempted to kill her.